Our group is group number 6. We will be presenting about the psychological skill training. Our group consists of 4 members, which is Muhammad ZULHAIRI FIKRI bin ZULKIFLI, Muhammad IZUDDIN bin NORLIZAM, NURZUELAIKHA binti AFFIZAN, and me, Syed Haziq bin KHAIRIZAM. Right. Firstly is introduction of sports psychology. Sports psychology is slowly becoming an integral aspect of the holistic care of the sport, medicine and physical rehabilitation patient, because many of these abilities are relevant to the care and the management of the athletic population. The coaches should have some awareness of the many aspects of sports and performance psychology. Sports psychology is defined by the American Psychological Association (APA) as a skill obtained after obtaining a doctorate in one of a basic discipline of psychology and licensed as a psychologist. Sports psychologists try to teach athletes how to perform optimally on the highest possible level, even under challenging and non-optimal conditions. Performing optimally means that the athletes can deliver 100% of performance at one specific point in time. Sports psychology is a talent that combines psychological knowledge and skill with sports knowledge and skill to address the athlete's optimal performance and well-being, developmental and social element of sport participation, and systematic difficulty in sport context and organization. Sports psychology has grown in the prominence worldwide since then, both as an applied practice and as academic endeavor. Over this time, significant progress has been made in our understanding of the relationship between mental skill and the athletic performance, with a sustainable body of information supporting it used in the field of performance enhancement. Next is psychological testing. Psychological testing may sound intimidating. It is intended to assist us to arrive at a diagnosis of the treatment. It uses the test and other assessment instruments to evaluate and observe a client behavior. Psychological testing and the assessment are similar to the medical test in many aspects. The psychological test can help athletes and performers discover their strength and deficiency, as well as evaluate the efficiency of the psychological skill training programs. There are several examples of the psychological testing. Firstly is a test of performance strategy. The test of performance strategy TOPS, developed by the Thomas and the colleagues in 1999. They are measure athletes' use of psychological skill in a competition and at play. Ongoing development of the TOPS to confirm and improve its psychometric properties has resulted in a 68-item inventory that measure self-talk, emotional control, goal setting, imagery, activation, relaxation, and attentional control in both competition and practice settings, and negative thinking in competition. Second is measures of the toughness. Mental toughness is one of the characteristics of Olympics champion use. Syed and the colleagues in 2019 has developed a sport-specific measure of mental toughness to provide the contextual understanding of this multidimensional construct. The values, attitude, cognitive, and emotions that defines mental toughness comprise some components that are common across sport. Example, self-belief, confidence, personal value, intentional control, self-motivation, positive and tough attitude, enjoyment and thriving through pressure, resilience, and sport intelligence, as well as context-specific characteristics. Example, team unity, quick reaction. Lastly, other self-reports measures. Marsh and College in 2012 have developed the physical self-description questionnaire to measure the endorsements and the other participants' physical self-concept, and the Elite Athlete Self-Description Questionnaire (EASDQ) to measure the elite athlete skill level, body sustainability, aerobic and anaerobic fitness, mental competence, and performance. Athletes respond to the EASDQ, TOPS, and the flow scale indicate there's a positive self-concept for skill performance and appropriate level of the reaction and control of thought and emotion are predictive of both dispositional and state flow. So that's all from me. We will proceed with our next presenter.
Hi, I am FIKRI. I will continue with psychological aspects, which consists of 5 aspects that are arousal, anxiety, attention, confidence, and concentration. Firstly, arousal is referred to as a psychological state of alertness and anticipation that prepares the body for action. Arousal levels must be controlled. There are some theories that can be related to arousal, such as the inverted U hypothesis. This theory states that there is an optimal level of arousal which will differ from sport to sport and athlete to athlete. Performance level will be at their highest at the optimal point of arousal. If arousal is too low or too high, performance will be lower. If arousal is too low or too high, performance will be lower. Secondly, anxiety. Anxiety can cause negative thinking, resulting in poor performance. This negative emotional state is associated with stress, feelings of worry, nervousness, and apprehension. There are 2 main types of anxiety, which are trait anxiety and state anxiety. Trait anxiety is a personality disposition that is stable over time, while state anxiety right now feelings that change moment to moment. It is temporary mood state, and it comprises of 2 types of cognitive state anxiety. Shows the amount of worry, while somatic state anxiety refers to the physiological changes due to perceptions. Thirdly, attention. An athlete must focus on the relevant information that will lead to successful performance other than irrelevant information. Attention can be either internal or external and broad or narrow. When athletes are focused inward, such as thought, emotion, physical sensation, they are said to have an internal focus. Athletes who are focused on the environment outside of themselves, like weather conditions, are using an external focus. Fourthly, confidence. Confidence is commonly defined as the sureness of feelings that you are equal to tasks at hand. This sureness is characterized by absolute belief in ability. This well-known someone whose self-belief has this unshakable quality, whose ego resists even the biggest setback. The more confident you are, the more likely you are to achieve your goals. Lastly, concentration. It is the ability to focus and concentrate on a given sporting task will aid performance and success. Within sports, coaches and athletes often use the words concentration, attention, and focus interchangeably. According to Vernature 2003, define concentration simply as the ability to perform with a clear and present focus. Focus has been defined as the central point of one's attention. Attention is simply what an individual is observing. When put together, an individual who is concentrating is said to have their attention focused clearly and presently on the task at hand.
Thank you, previous presenter. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad IZUDDIN bin NORLIZAM. I will continue the presentation with the next subtopic, psychological skills training. Psychological skills training is the systematic and consistent training of mental or psychological skills with the goal of improving performance, increasing enjoyment, or increasing sport and physical activity self-satisfaction. Psychological skill training also can improve performance at elite levels and every person. Therefore, psychological skills training should be systematic, goal-oriented, planned, controlled, and evaluated. Next, we move to the phase of the psychological skills training. There are 3 phases of psychological skills training. The first one is education phase, the second one is acquisition phase, and the third one is practice phase. During the education phase, athletes will be able to recognize and acknowledge the significance of obtaining psychological skill training in order to improve their performance. To achieve this goal, it is critical to ask athletes about their perception of the mental side of sport performance. It is also essential to inform them that psychological skills can be developed over time. During this phase, it is also the best time for the team psychologist to conduct a needs assessment. The purpose of this assessment is to determine which mental skill of the athlete should be developed the most. Apart from that, the assessment is a useful tool for determining which mental training tools will be used to develop those skills. Next, acquisition phase. The acquisition phase is used to learn psychological skill by implementing strategies and techniques. This is also the stage at which strategies are developed to meet the specific needs and abilities of athletes. The primary goal of this phase is to assist athletes in developing the skill they desire. For example, as a way of teaching athletes about the development of arousal regulation skill, the team's psychologists can facilitate discussion on positive coping statement to eliminate negative statement under stressful conditions. As with relaxation technique, the team psychologist must be aware of the various reactions of athletes because some athletes may experience mental anxiety or tension and other athletes may experience body type anxiety. With this statement, it is demonstrated that the team psychologist should employ a variety of relaxation techniques for athletes who suffer from various types of anxiety. Clearly, the team psychology should use a cognitive strategy for athletes who are experiencing mental anxiety and a physical relaxation strategy for those who are experiencing physical anxiety. And the last phase is practice phase. Once the athlete have grasped and implemented their desired skill, they must proceed to the next phase. Practice phase has three primary goals. The first goal is to automate skill through overlearning. The second goal is to teach people how to incorporate and apply psychological skill in real-world situation. And the last goal is to practice skill that will be used in real-world situation. This can be accomplished through meetings, physical training session, and personal practice. To achieve this goal, athletes must use the tools and skills in a variety of ways, such as simulation and competition, which eventually become similar to full-fledged competition. Athletes can stimulate adverse situations in practice to help them deal with them during competition. Through a simulation, it can help athletes to apply mental skill to their game plan while dealing with challenge. Team psychology can also encourage their athletes to visualize themselves achieving their goals. If an athlete is experiencing life stress during practice, it is best to advise him to visualize a peaceful area or location where he can relax and mentally prepare for the challenge. To achieve the desired result, imagery practice must be systematic. This is something that most athletes fail to do, because most of the time they use imagery a few times in the days leading up to the competition. They do not do this as a regular basis. It is important for the athlete to understand that imagery is only effective if it is practiced consistently. Athletes must first practice physical skill and strategy before engaging in imagery practice. They can use imagery to improve psychological skill like stress management and motivation. These mental abilities must be tailored to the specific needs of athletes. Following that, they will be able to incorporate imagery during competition. And the team psychologists can encourage athletes to use imagery both before and during competition. For example, in the locker room or on the bench. That's all for me. We move to the next presenter.
Assalamualaikum. My name is NURZUELAIKHA binti AFFIZAN. So today I will present the psychology training method. So the first one, we have goal setting. What is goal setting? Goal setting is a method training technique that can be used to increase an individual's commitment towards achieving a personal goal. In terms on sports psychology, athletes are aware of their present performance levels and can create specific detailed plans to achieve their goals. So there are several goal settings principles. For example, set goals for mental as well as physical skills, remain flexible enough to adjust goal as needed, emphasize performance goals over outcome goals, and lastly is set goals that are specific and measurable. Next, we have a self-talk. So self-talk is involve having a dialogue with oneself at the outlook or in one's head. much of it comes from our subconscious mind, which can shape your thoughts, actions, and belief. So this method is used by individuals to instinct their and motivate performance of skill and exhibition of certain behavior. So we have 3 different type of self-talk, which is positive self-talk, negative self-talk, and instructional self-talk. So positive self-talk, this tend to consist of positive thoughts and words that make you feel good about yourself. So negative self-talk is contrast in the voice of self-doubt, which can be depressive, upsetting, and have been found to have an impact on performance and recovery. So instructional self-talk is thoughts that can be used for guide ourselves, often when learning a new skill or completing a specific task that we focus on. So next, we move to the mental imaginary. So mental imaginary is a fully immersive multisensory procedure that associates as numerous senses to create a mental image and process it without the presence of external stimuli. So in the sport situations, imagery has been designed as the state in which people imagine themselves while affecting ability to deal with the forthcoming duty or improve the performance. So methodical analysis have revealed that imagery increases performance in motor tasks. So mostly athletes use imagery during competition to prepare for actions and recover from errors and post-performance. So next, for the mental rehearsal. Mental rehearsal is an umbrella term that covers several techniques used by athletes and exercises to improve performance. It happens covertly and without any actual movement, and typically involve the representation of an action or behavior using non-verbal, for example, imagery, observations, or verbal process, for example, self-talk. So in other situations, let's say that an athlete may think in their mind eyes about a skill to be performed using imagery or repeating keywords associated with successful execution of that skill using self-talk. So, and lastly, we have realization. So realization training focuses on becoming aware of tension within the mind and body. So the systematic realization methods such as diaphragmatic breathing, progressive muscle relaxations, guided imagery are used to reduce tension and to change the perception of physical pain. So that's all from me. I will proceed to the next presenter. Thank you.
As a conclusion for this topic, several psychological factors have the potential to negatively affect an athlete's ability to perform autonomously. Example, anxiety, nerve, poor concentration, and self-doubt. However, discriminal of the thought, attitudes, and belief all affects an athlete's ability to execute skill at a level that they are psychologically capable of. As such, the role of the sport psychology is to provide the athletes with the necessary tools and the strategies to address their psychological factors as they arise and those minimize their negative impacts on performance. The use of the psychological training skill may be of interest to the practicing physical medicine and the rehabilitation professional in the treatment of the athletes. The physical medicine as a professional of recognized by the sports or performance psychology represent within the paradigm of the psychological interventions. So that's all from us. Thank you for watching.